So I will address Saw Palmetto, which is a wonderful herb. I don't want to sound like I don't like it or don't ever use it. As a single agent of initial treatment for BPH, like I said, it's dismally ineffectual for most patients. I have seen it work. I actually like to use it as a tincture. You can dose perfectly good amounts of it. The standardized extracts are really based around good quality fruit extracts, so pretty easy to give that. I will use pretty commonly a tincture of Saw Palmetto, of seed and flesh of the fruit, so the whole fruit like you see here, combined with either an opopanax glyceride or astragalus glyceride to help with the taste and because of the adaptogenic effects, decreasing stress, etc. So a very big negative study came out on this in 2006, published in the notoriously anti-natural medicine New England Journal of Medicine. It was a robust study, 225 men for a year, but it found no real benefit compared to placebo for symptoms. But this was a population that had more severe BPH than pretty much all the other prior German clinical trials. So I'm kind of dubious that this ruled out what has gone before. Also, this particular study did not use the same extract that most of the German studies used. In Germany, they used a product called Permixon. The product in this case met all the same analytical assays that the Permixon met, but who knows how these things differ. So anyway, that said to me, yeah, that kind of fits. I don't see it being dramatically effective for symptoms either. But these data are more interesting to me because they're much longer term. And in particular, the third one listed here, a 2-year trial where they looked at how many men ended up needing surgery for BPH. And this was on Permixon, the standardized extract, which, again, I'm not a huge fan of, but it's fine. None of these were placebo-controlled, double-blind, so that is a weakness that I acknowledge. Nevertheless, what this particularly the third study showed was quite a dramatic prevention of worsening of the disease, in particular, cutting the risk of ultimately needing surgery in half in that one trial where they looked at outcomes. What that was compared to was a watchful waiting group. So some of the men, 101, did not have any treatment for their BPH, and they just watched for 2 years and ultimately decided to have surgery. There's no controlled trial of Saw Palmetto lasting more than a year. So I do generally put men on this who have BPH, but it is with the understanding that it's to prevent worsening. It's not something they're going to notice or feel, so I tell them, go ahead and take this kind of long-term, many years, and we'll decide if it's working based on whether you end up worse in 2 or more years. Also, it's cheap. So a little bit more history with Saw Palmetto because it's such an important issue. People ask about it. Of course, famously, people think that it's a 5-alpha reductase inhibitor, and this is one of the early studies that showed in men that it had that effect. So this was a study of 25 men with symptomatic BPH that lasted 1 to 3 years, and they were either randomized to no treatment or, the Permixon standardized extract, 320 milligrams per day for 3 months. And all of them underwent prostatectomy at the end of the study, and then they could look at the tissue percentage of inhibition of 5-alpha reductase. So they were pretty much planning to do the prostatectomy anyway, by the way. You can also see, though, that they showed in that study that it inhibited epidermal growth factor by about 50%. So this is not a one-trick pony. Saw Palmetto has many actions. This hormonal stuff is just one part of the puzzle, and it's actually, I think, a really good thing that it only inhibits about 50% because that really helps to avoid some of the adverse effects that we see with drug 5-alpha reductase inhibitors. So this is a little gift that the Merck company gave us. They are the makers of the drug finasteride, or the branded version. And they wanted to show that their drug was better than Saw Palmetto. So this was a study of 3 groups of men. The first group, 15 men taking finasteride. There was a control group of 7 men not taking anything. And then 40 were taking a Saw Palmetto standardized extract and mix. This for 6 months. And then they all had prostate biopsies at the end. So these percentages here are compared to baseline. And what you see clearly is that finasteride has a substantially higher percentage of inhibition, 5-alpha reductase. And of course the authors conclude that therefore Saw Palmetto is worthless, finasteride is way better. But I would further say, hey, that's actually a really good thing, and in particular because the serum testosterone levels actually fell in the finasteride group, but not in the Yarnell group. And finasteride is famously known to cause low libido and a lot of erectile dysfunction, which Saw Palmetto almost never causes. So I think they actually proved that in men, Saw Palmetto is safer than finasteride. It works by multiple actions, not simply as a 5-alpha reductase inhibitor. And that actually it's probably a much better idea in these milder cases, especially spasmodic cases, to use it than finasteride. I'll talk about the place of that drug with the hormonal type later. So here's just the reported areas where we know that Saw Palmetto works. So it is a mild 5-alpha reductase inhibitor. It mildly blocks binding of dihydrotestosterone to its receptor. It's a mild phytoestrogen. It blocks these growth factors like epidermal growth factor. And it also is a spasmolytic that should say alpha-1 adrenergic receptors there. So many different actions.